You really just want me to walk?
Yes.
The announcement about the death of the doctor was made on Monday, stating that he had died as a result of high blood pressure, a condition he had suffered from for some time. The American, who also had a Rwandan nationality, passes away at the age of 62. In 1987, he was among those to found the non-profit organization Partners in Health that helps to promote the health and livelihoods of people in nations across the globe, in Haiti, Sierra Leone, Liberia, Lesotho, Malawi, Peru, the Navajo Nation in the US, Mexico, Kazakhstan, Russia, and Rwanda. In Rwanda, working with the government, the organization has established 2 hospitals and a university.
Wasangaga abaturage akeshi na keshi bafite ibibazo
Before, local residents were ever sick and had to travel long distances to get medical attention, and this hospital changed all that. It treats all people, adults and children, and people with cancer.
abana abantu baturutse hirya no hino kuri kanseri n'ibindi byinshi.
Here they are able to get a person's bone marrow, a procedure I had never seen performed back home. They found cancer in mine and immediately gave me chemotherapy and other medicines. Now I am much better and thank them a lot for it. Doctors here are far more caring towards patients. They give us 3 meals a day and for free.
Thank you.
In 2019, Dr. Paul Farmer was presented with the Igihango Medal by President Paul Kagame.
For me is extreme composure. I have been lucky enough to be a friend of Rwanda for 2 decades and lucky enough to be a Rwandan citizen for over 1. And I have also considered this country to be my teacher and my friend. And if a country can be incarnate in people, if a nation can be incarnate in people, then I'm sitting in a room full of people who have made this nation a lesson for the world. The best that I can say is Murakoze Chane.
The doctor's courage and determination to help communities around the globe, not just Rwanda, was acknowledged by the president.
You have elevated global health to a level where it should be, and you've brought part of it with you to Rwanda, and what you've done over the years in our country, particularly, has been at the center of our development, Rwanda's development in that sector. Most of the things have really been done around you and your work and with your colleagues, whom through you we also extend gratitude. As you said, looking ahead 20 years, we are still with you and we always appreciate you. Thank you very much.
On Monday evening, President Paul Kagame tweeted the following about the late Paul Farmer. It is hard to find the words to express the sad news of the passing of Paul Farmer, the person, the doctor, the philanthropist. He combined many things hard to find in one person. Paul Farmer, who had a master's degree and PhD from Harvard University, was also the first ever Colloquatrons University professor at Harvard and chair of the Department of Global Health and Social Medicine at the Harvard Medical School, chief of the Division of Global Health Equity at Brigham and Women's Hospital in Boston, and of course the co-founder and chief strategist of Partners in Health. Dr. Farmer and his colleagues pioneered novel, community-based treatment strategies that demonstrated the delivery of high-quality healthcare in resource-poor settings. He wrote extensively on health, human rights, and the consequences of social inequality. He was a member of the American Academy of Arts and Sciences and the Institute of Medicine of the National Academy of Sciences, from which he was the recipient of the 2018 Public Welfare Medal in the US. He also authored multiple books. He leaves behind a wife and 3 children.
This is what, for me, is extreme composure.